So radiohumeral distraction. If you need to find the radius, you find the epicondyle. That's usually a pretty easy thing to find, right? And then from there, which direction would I move to find the radial head? Yeah, inferior. It is on the lateral side, but it's just pretty much kind of coming down, traced down the arm. What am I feeling for to know I'm in the right spot? Dip right before the notch, and that's where you want to be. You want to have your index finger right on that little dip that's there, and it's kind of relative to the forearm, right? It's not up here on that in the big muscle. It's behind the muscle. You're going to grab the radial styloid process, kind of hook it with your thenar eminence, and then your fingers. So I have this finger kind of coming in, is bent, and then my hypothenar eminence. I'm going to place the radial styloid process, so I kind of catch it right here. Catch the radial styloid process. Now I'm squeezing down to the bone no further, palpating the joint, kind of lock the forearm up against you, and then lock and rock. If you try to pull with your hand, it's actually really hard to hold on to the radius. Humerus stabilized with my hand, and then just rocking out a little bit. You can feel a nice distraction at the radiohumeral joint. So for the humeral radial joint, so for our distraction, it's the same thing we did before. Okay, you're going to grab here. This time just make sure you're stabilizing the humerus. Get a hold of it, rest it up against your leg, and pull. And just, you can do it as an oscillation, you can do it as a mobilization, but it's the exact same as we did for the assessment. You're going to pinch the head of the radius. And this is the key to doing this one well, is pinching it. If you're trying to squeeze through the muscle, you're going to have a tough time holding onto the radial head. Find the radial head, pinch down. I'm in extension, supination, get over top, and then I'm just looking at a posterior glide. And for an assessment, I can pull up for an anterior glide. Okay, or you can have a seat. I'll show you in sitting as well. In sitting, same thing. Nice thing about being in sitting here is I can actually palpate that joint line. Get him in position. If they don't have enough supination, where can I pick up more? Yeah, I can externally rotate the shoulder to get more supination out of it. Pinch the radial head, come over top.
You said this was for
radial,
humeral radial?
Yep, humeral radial.
Why wouldn't it be for humeral owner or radial owner?
So a couple of things. So posterior glide for the radiohumeral joint would be for what motion at the elbow? Extension, good. So we're going to essentially go to the point of restriction. So if we're here, so let's say for our purposes is here, we can stabilize underneath. If they have, if they have a lot of limitation in their extension, you might do this in sitting so that their forearm is resting against the table. But essentially I'm going to stabilize the humerus with one hand. I'm going to find that radius with the other and use my hypothenar eminence and just do a posterior glide of the radiohumeral joint. For anterior glide, that's for flexion, so we're going to bring them up into flexion. Find the radius here. I'm holding on with both hands. I'm not pushing with my left hand. I'm pushing with the hypothenar eminence of my right hand here, or whatever hand happens to be over the radial head. So I'm in the range, the arm is stabilized down, and I'm doing an anterior glide. It's going to be perpendicular to the forearm. So wherever it is, if it's down here more, I'm going to have my forearm down more. The higher up we go, the more my forearm pushing here. If you need to put the belt down, remember we showed how to put the belt on last time underneath there? That's fine if you need to stabilize that. Most of the time with this one, you're probably doing it more around in this range, and so you're kind of just pushing down into the table anyway, so it doesn't really matter. All right, so that's, I want to distract the humeral ulnar joint. I want to feel with my finger, how does that olecranon move away from the humerus? That's what I'm assessing. So I'm palpating just lateral. I have half my finger on the humerus, half my finger on the olecranon. Because I'm doing a mobility assessment, I'm not doing a treatment right now. I'm up into, around 70 degrees of flexion, and my forearm's perpendicular to his forearm. All right, so I'm here, and now my movement, again, I'm using the body to just distract. See him move? You've gone too far, right? This is just a mobility assessment, not a treatment. Tighten down. And then you have your stability there. Okay? The humeral ulnar joint. So have a stability off the edge of the bed. You can also use a wedge for extension. So it's always a distraction, right? So if I'm doing for extension, I'm going to just go out to the point of where they're restricted. Forearm is perpendicular. Coming off the edge just a little bit. So what you saw is as I was pushing, it was kind of rolling off the edge, so it lost the stability, so we just moved you into a better position. Take up the slack of the table here, and then I'm doing my Oompa Loompa, just squatting into it to get the distraction. If I'm here, I can probably still be in this position. All right, I can still get a distraction. As we come further into flexion, I can't do that same technique, right? What I'm going to do now is come in with my fingers. So kind of like you did at the hip, where you came in and did the gripping there. Same idea. Kind of come in, scoop up in the elbow, get your little fingers as far down in the crease as you can. You can kind of use your shoulder as a little bit of support. And I'm going to pull out from here, or even up more. All right, so that's the proximal anterior posterior glide. And then find our radial head, pinch. And now because we're in this position, and this is a little bit high, I would actually like him a little bit lower, which would then put his arm instead. But we're going to account for it for being a little bit higher. So it just means my angle is now a little bit more down to the table. 70 degrees of flexion, slight supination. The angle is going to be about like, so now as I bring him up onto the table, you can see how that's shifting my angle in. So you're really going from a little bit like medial and anterior and posterior lateral slightly. Table is kind of our block for the ulna. I'm going to get my forearm stabilized at the humerus here to help hold. Use my body to do an anterior glide or a posterior glide. You can palpate with your finger there. You should feel more movement here than you did when you were doing the radial ulnar joint. Kind of externally rotate his shoulder. I'm going to stabilize the ulna because the radius moves on the ulna, right? So if I'm doing a posterior glide, which is for which direction, which movement? Yeah. Stabilize the ulna. Hold on to the distal radius. Line is going to be, if you draw a line straight down the middle of the forearm, the plane of the joint is going to be going parallel with that line. Posterior glide. And then for an anterior glide, kind of internally rotate his shoulder. Hold the ulna. Get on the radius. Anterior glide. So if I'm going to do from this, if I'm going to be on this side, which glide am I going to be doing? Anterior. And so would that be more for pronation or supination? Good. So we're here. Supinate out to the point of restriction. Find your radial head. Hypothenar eminence. We're going to stabilize the ulna. Try not to block the radius. And I'll hold on to the ulna there. Use the table to help you out. Get your forearm in line. And then it's just an anterior glide there. Or for a posterior glide, if I'm standing on this side, pronation. So pronate her to the point of restriction. Radial head, hypothenar eminence. Now block the ulna. Get your forearm down in line. Posterior glide there.
When you're blocking?
Kind of like right here. So her radius is here, and there's a little bit of her ulna here. There's a gap in between. I'm kind of just hooked into that and pushing it down into the table. I'm trying to leave a little bit of space up here. Pistol. So same thing. So a palmar glide is going to be associated with pronation. Pronation, palmar glide. Just put a finger up under the ulna here. Give me a little bit of a block off the table. Stabilize the ulna. Hypothenar eminence. Or same thing, I'm blocking underneath the ulna, stabilize the ulna, and then a posterior glide. Supination. Yep, externally rotate the shoulder, and now it's in a much better position for me to